Delivering the keynote presentation today is Dr. Wayne Chong. He's the Executive Director of Gyropsych Consultant Private Limited, a psychological knowledge enterprise which provides consultancy and training on psychological aspects of aging and caregiving for seniors. He's also the Honorary Board Director of 3 social service enterprises and editorial board member of 3 scientific journals. Dr. Chong is here today representing the Gerontological Society to share with us on his talk entitled Defying Dementia, Dive into Digital Health Communities. Let us welcome Dr. Chong, please.
Thank you, Leonard. I'd like us to give us a moment and pause and think. When you were 21 years old, okay, besides school, what were you doing? Just give us a moment to think. Were you in some co-curricular activities? Yes. How many of you were actually dating in 2021? Thank you for your honesty. Great. The rest of you are responsible for the low birth rate, suppose. Okay. This is me when I was 4. My grandmother, I call her Apo. She was really the one who brought me up because my parents were busy working. I did not know that years later when I was 21, that I would actually become a caregiver for her. Because she was taking care of me, you see, as you can tell, right? She was holding me up and she would bring me to all the festivals. Lantern Festival, Moon Cake, Christmas, what have you, organized by today what we call constituencies of care, like People's Association, grassroots organizations, welfare homes, and so on. She was in fact a temple volunteer and who would bring me to those activities. So we had a great relationship. By the time I hit 21, I didn't realize that she needed help. And so you can imagine how it was like when I saw my mom, who was battling depression of her own, right, caring for an older person like her, like my grandmother. And I felt sad for my mom because the caring for her mom was actually making her depression worse. Right? She had to do so many tasks. Later on, then only I found out that she was not just a mom to me and a daughter to my grandmother. She was the nurse for my grandmother. She was the medical escort for my grandmother. She was the health educator, teaching my grandmother what was rheumatism, what was high blood pressure, what was diabetes. She, at some point, almost became the driver for my grandmother, driving, but she didn't pass her driving exam. So here I was, at 21, while my peers are dating, and I wasn't, I was caring for my grandmother because I loved her. As a family member, as a grandson, as somebody who has been brought up by this very person who now requires care, I now care for her as a loving grandson. And I was happy because I was also relieving the burden of my mother. That was me. So I found myself changing adult diapers, and that was, to say the least, embarrassing. I found myself showering my grandmother, having to brush her body, right? Lather her body with soap and then rinse it off with water and then carefully transfer her in the bathroom, half naked, onto the wheelchair and pushing her out, further drying and then wearing her clothes. I found myself in a variety of these tasks that I wasn't trained. And at one point, I realized I broke down. There was this one occasion. Right, this one occasion, I came back from school. I was already tired and stressed. There was just so much work to be done. And Grandma Apo was just kind of complaining, or I felt she was complaining to me that I didn't take care of that well or didn't take care of this well. And in that fit of moment, I just pushed her. Wow, man, I really regretted it, but I did what I did. wrong. What happened was that she injured her right elbow, bruised. Thankfully, no further injuries. But what really pained me was this. Her most precious jade bracelet. You know how older people like jade? Was smashed into 3 distinct pieces. And I still kept it here somewhere. My brother has it right now with him. And I just don't have a picture to show you. But that made me break down and cry. And then I realized, if I could feel so stressed, so burdened, so frustrated, and it's not really something big that my grandmother did wrong. She was just complaining, and all of us complain every day, right? I mean, Singaporeans, we complain, right? But just that kind of 1 minute of complaint can get me so worked up. How much more for my mother who has depression? How much more for the many, many untold others who have conditions much worse than grandma, than Apo? When grandma eventually became more frail and had to stay in the nursing home, and you could see the nursing home here, and I visited her once a week, every Sunday evening, I realized there were other older people in the home called residents who did not have the privilege of a grandson or a daughter visiting every week or every month. What did they have? Maybe not even once a year, during Chinese New Year, Hari Raya. No. Then I realized the pain my mom is going through and the little bit of stress that I felt because I was helping my mom to care for her mom probably is just this much, of the loneliness, the depression, the isolation that many other older people feel. And that was the year 2010, if I recall correctly. Fast forward later, I heed the nation's call. I got married and I have children. And in that year in which I had my son, my wife was expecting our son. My mother was stricken with cancer. By then, my grandma has already passed on. My mom was stricken with cancer. So here I was, straggling the hospital. 1 month attending my mom's medical appointment. The other month, attending my wife's prenatal appointment. I recall one incident that I'll never forget. Right after attending my mom's gynecological cancer center appointment, and it was KK Women and Children's Hospital, which I think many of us are familiar with in Singapore, right? I had this SMS that came from my wife's side telling me about the changed appointment that she had. Look at it. I was stunned. Same day, same time, my mom's. What am I supposed to choose? Right? What am I supposed to choose? That made me go into a dilemma, and that reminded me of the sight I saw in the nursing home when I had with my grandmother. Caregivers are sandwiched. I was sandwiched then between my mom and my wife who will give birth to our son, my first child. You can imagine how anxious I was, right? As a new parent or expecting new parent. And unfortunately for me at first, my attempts to try to change either one of those appointments didn't succeed. It's not so much that the doctors were busy. Yes, of course, doctors are busy. We expect them to because they're caring for our seniors and people who need help. Sure. Thing is though, I had to jump through so many hoops just to get the person in charge of the appointments. Then we didn't have Health Buddy. Then we didn't have the SingHealth app or the NHG app that allows us to change appointments just like that. Then we had to call and wait for 3 to 5 working days for the nurse to call you back. And if you're in the toilet, that's it. Yeah. Or if you're in school and if you're in the lecture theater and you are a respectful student listening to your lecturer, you wouldn't pick up the call, right? Then, that was me. So in 2018, fortunately, I was able to ask my brother, my younger brother, to attend my mom's appointment. He was actually overseas. But somehow he came back at that time and I just jumped into it, and I was very thankful that he was able to attend that because that was an important appointment. There was going to be a change in the oncological treatment. My mom's cancer wasn't responding to treatment at that time. And I heaved a sigh of relief. Treatment progressed. My wife also gave birth safely to a healthy son. Fast forward, after my mom passed on from cancer, my dad became frail. He undergone, I think, a series of mini strokes called transient ischemic attacks. That is the part where his cervical spinal cord, the C2 and the C3, if you're familiar with the lumbar spine, that is the part that kind of overlaps with breathing, or controls partially your involuntary breathing. You can't control whether you breathe or not. You can hold your breath for 10 seconds, but that's about it. So he had problems breathing, and I recall the funeral. Eventually, when he passed on, that there was only to be 10 of us at the funeral because of COVID. Right? But once again, I understand that this is 10 of us because it was COVID and we didn't want to spread to one another. And I had to make the painful decision to make calls to my aunties and my uncles to tell them, please don't come because there is COVID going around. Right? And I realized, wow, I've just been a caregiver like 3 times over. And what did I get out of this? I realized that many of us might actually go through worse. Many of us might be a caregiver someday. And if you are fortunate to live long enough, if you want to live long enough, that might be a spouse to you. Or if you're like me, you might be sandwiched between the older and the younger children. Today, interestingly, Google gives me a title. If you Google Wayne Freeman Chong, it says caregiver. I don't know how they know that I'm a caregiver. Actually, I am a parent today, yes. I was a caregiver. I mean, didn't Google realize that after parents pass on, I is a caregiver? So perhaps they somehow found my story on LinkedIn. That's why. So today, I'm here because I'd like us to think about this. If each of us has a chance to be caregiver, wouldn't it be necessary for us caregivers to be connected, not just to our patient, but to the system that is supposed to help the patient and to help us? That is what Lei Chu called earlier as constituencies of care. We're talking about a system that's bigger than just the healthcare system. Some of us from healthcare, you probably have heard of this thing called the RHS, yes? Regional Health Systems. It is a phenomenon in Singapore that started about 20 plus years ago. From, 6, it became 3. And today we have the National Healthcare Group, the National University Hospital System, and the SingHealth system, right? That's the RHS to us. Okay? Now, the constituencies of care goes beyond healthcare systems to our welfare organizations, to our caregiver support, to our social service agencies. That is the linkage that now is missing that we want to build in 2 ways. 1, the actual processes, and 2, the digitalization. So today, we are here to talk about what constituencies of care is. I'd like to share with you 2 myths that is currently stopping or a great barrier to the building of these constituencies, and I'd like to share with you what are some of the ideas that digital health organizations have to help build these constituencies for health. All right. This is perhaps the second most complicated slide you will see. Right? So I said that there are currently regional health systems, right? So that's one layer. Patients are discharged from RHS, whether it's a hospital or community hospital and so on, and they go into the community. They go home. But they don't really go home and just stay alone and then disappear. Right? They get services from community-based care organizations. Some of you are here today. Right? And then, if the caregiver needs help, First of all, they need to understand that they are providing care and they are becoming a caregiver. And if they need help, we have organizations for them, whether in the private sector or in the public sector. Right? This is one part that perhaps needs to respond. But here is the other group. How many of you actually belong to grassroots organizations here? Anyone here? Thank you very much. Yes. Those of you who belong to grassroots organizations, whether as a staff or member or volunteer, or you're just an observer, right? You would know that many of the needs in the division, in the constituency, the constituents, I'm just trying to use your lingo here, right? Actually are related to aging, right? And the ailment and the adaptation that comes with aging. So we have 4 layers. The question though, do we have 4 mechanisms? You see, if we have a seamless, if we have an app that allows me to view at one glance the medical appointment of my mom and my wife during when I was sandwiched, and if that app is able to tell the nurse or the discharge coordinator or the medical appointment officer that actually this caregiver here already has somebody to look after and have to attend that appointment, I wouldn't be getting a message that says, look, you have the same appointment on the same day, right? That's a mechanism that was lacking then. The question I have for us today is, do you see such a mechanism today in community? How about in residential care? Some of us come from nursing homes. Some of us work closely with nursing homes, from one ward to the next. Right? Do we have technologies? Do we have processes first? Before technologies could help, do we even have a process that is able to say, look, if Madam so-and-so is in ward number 1, okay, taken care of by nursing manager, Madam Tan, let's say, right? Then she is probably eligible for that community-based program that comes, whose volunteers come in once a week. Right? Do we have nursing support systems like that in residential care? So we have regional health systems that's discharged. Today, thankfully, in each of the main hospitals, you see the iCare link, right? And I think Agency for Integrated Care must be very proud of this. Right? Starting with the Changi General Hospital, it has moved. Now every single hospital, right, in Singapore has an iCare link. That helps discharge coordination. That's great. Some of these colleagues of mine, unfortunately, do not really know what happens to that older person after discharge. So then, as much as discharge planning could be done, okay, does the person actually use the recommended service? In Singapore, the statistic is this: about 55% of community-based and home-based long-term care services are utilized out of those who are referred. That means about 4 in 10 older people who are referred to intermediate and long-term care facilities are not attending them. 4 in 10. Why is this so? Is it because of some processes, some mechanisms that's lacking? How about here? How about from grassroots organizations to regional health systems? Those of you who volunteer with grassroots organizations, when you see the older person needing help, you ask that person or you ask that family member, please take him to the hospital, please make an appointment for him. What if you could do it as a grassroots volunteer? What if you could go into the app and because you are the grassroots volunteer, you could go in? So here we are saying, look, we have no doubt 4 layers in the constituency or constituencies. We still need to build the processes such that each layer could function seamlessly with the others. This is where I bring you to this one. On its own, this statement is not a myth. I mean, I started caring for my grandmother because I'm a family member, yes? Right. Now, let's just ask to raise our hands. If one day, some older family member of yours, okay, starts to become frail and needs care. How many of you, the reason that you will provide care, medical support, bring to hospital, teach about medical appointment and so on and illness, how many of you have this reason that it is because he or she is my mother, my father, because I want him to be great, I want him to be well, I care for him. Therefore, I don't mind spending the time and money, even if I'm tired, helping him. How many of you have this reason? Thank you very much. Thank you very much. Virtually all of us would have this reason. The point is this though, many of us who go into caregiving with this reason may not evolve into a caregiver role because we did not or do not recognize that we are caregivers. Let me try to show you what I mean by this. You see, research has shown that families and not individuals decide on whether or not and the extent to which long-term care service is used. Okay? Caregiver capacity, it's a big one. Work commitment of the caregiver, financial resources, availability of other caregivers, time, caregivers' perception of the quality of care for the care recipient, i.e. the patient or older person, influences his or her recommendation to the care recipient whether or not to use long-term care. Of course, the care recipient's perception and mental and physical condition also plays a big part. So we found in research that utilization and non-utilization, that is the 4 in 10 who are not using, is probably because of a combination of these, right? Now look at the quote here that I provide. I know I'm not able to give 100% caregiving because my daughter is growing up. As kid is involved, my priority is definitely my family. Even though my dad is my dad, but there are still concerns that I have to make sure that my husband is fine, my family is settled. So the best I could do is to send him for medical checkups, liaise with doctors, and visit him. Can you see the sandwich nature of caregiving here? Can you see how this caregiver is probably going to make this decision together with the care recipient? And in this case, the care recipient is not one care recipient, it's one care recipient older and one care recipient younger. Right? So, this is what I would say a caregiver. She, if I'm not wrong, it's a she, right? Okay, I don't know if it's a he or she. Is it a she? It's a she. Right? She understood that she is in a caregiver role. Okay. She has this role to play for the older person and the role to play for the younger person. Those of us who remain in a I love my family, therefore I want the best for him or her, may not evolve into this role. This has been found in research to be one of the main myths or one of the main reasons that caregiver feels burdened. That because I have not accepted my caregiver role, I'm just doing extra, I'm just doing more because I'm a daughter, because I'm a filial son. That is the reason. So much as love brings us into the care role, love alone may not sustain the care role. This is an evolution that we need to make. We are loving families and caregivers. I love my mom, I love my dad, and now I am a caregiver for her. I need to learn nursing, how to change diapers. I need to learn how to manipulate the wheelchair safely. I need to learn basic wound care because for a diabetic patient, having a wound for sustained period is dangerous. I need to understand medical conditions such as high blood pressure, dementia. I need to know that certain conditions are not normal aging. That's a caregiver role that we are talking about today. That's the caregiver role that may be missing among us, that is causing undue, unnecessary burden and stress. Let me move to the next one. The aging experience is inevitable. Sure, the aging experience is inevitable. Well, the aging phenomenon is inevitable. Everyone ages, yes? I think we can all agree with that. Well, you can't help it. I can't help it. Today, here I am, okay? 20 years past the time I was a caregiver for my grandmother. Here I am. The thing is, though, is the experience of aging, is the experience of caregiving inevitable? Is there anything we could do to have a better experience? Or should every caregiver look forward to what I have gone through? Of course, we want the first one, right? We would like the caregiving and the aging experience to be great. And here is when I want to ask you this question. Raise your hand once again. How many of us here would like to live beyond the age of 80? Beyond. Hands up. I raise my hand. I want to. How many of us want to? Okay, 2/3. Not all. Okay, 2/3. Okay, thank you very much. All right. Okay. Now, those of us who want to live beyond 80, I'd like you to project into the time when you're 85. So imagine now you're 85, right now. Just take a few seconds. I'm 85. My hair is white, gray. Okay, I can't move so quickly. Project, right now you're 85, okay? Now, I'd like you to look to your left or right. Just look at two people. Make eye contact and say, hello, I'm 85. If you can. Left or right. Yeah. Can you just say that, please? Yeah, or behind or in front. Yep, you're now 85. Right? Two people. Okay, thank you very much. Hello, I'm 85. Hello, I'm 85. Now, the unfortunate statistic is 1 out of the 3 of you has Alzheimer's disease. Okay, if you refuse to believe that, and I see some smiling and, okay, then you're a caregiver. Because the statistics for Alzheimer's disease, one of the main causes of dementia, is 1 in 3 85-year-old and above. And in the Singapore context, the statistic is 1 in 10 for 60-year-olds. Not Alzheimer's, but all-cause dementia. And dementia could be caused by vascular causes like stroke, Lewy bodies, and other less commonly known factors. Now, what if I tell you today that dementia is preventable? What if I tell you today that cognitive decline is not a part of normal, healthy aging? You'll be interested to learn? Yes? How to do that? The aging experience does not have to be inevitable if we learn how to prevent illness. Aging is inevitable. The aging experience is not. Now, here's what I'd like you to do. So here it is. The experience can be changed if we put in the effort and learn how. Okay, I have an exercise for you to illustrate one of the things that I train or teach my workshop participants about preventing dementia. All right, I need you to, if you are having phones, laptops, can you temporarily put it aside, close your laptop if you need to. No need to take notes for this. We are going to play a game. It's just going to take 1 minute. I need you to look on the screen, pay attention, when we're going to see how attentive you are. Okay? All right, ready? Okay, everyone look at the screen. Okay, I'm going to give you 1 minute. Okay, use my watch to time it. And then I'm going to, in this 1 minute, show you a list of words. I'm going to read these words out to you, and then when time is up, I will say time's up, and then you will see how many you will remember. Okay? Ready? 1 minute. Try to remember as many of these words. 3 times 5, 15 words only. Okay, let me make sure I get my timer set up. 15 words in 1 minute. Let's see how many you can remember. Okay, ready? Here we go. Sour, nice, candy, honey, sugar, soda, bitter, chocolate, good, hot, taste, cake, tooth, tart, pie. You have 1 minute to try to remember as many as you can. Yep, you can write it down if you want on, yep, you can say it out, yes, if you remember. Candy, yes, cake, yes, bitter, yes, yep, got it, yep, tart, yes, right, if you want to write it down, nice, yes, right, okay, how many of you got sweet? Okay, some of you got sweet. Okay, now for the next one, now you'll probably get better in the next round. Same 15 words, but different words. I mean, same round, different words. This is the last try I'm going to give you. You'll get better, but thing is this though, now with your phone or laptops or paper, could you now write down so you can verify how many you remember, okay? Can you just write down how many you remember? Only after I say go, after I turn off the words. But I'm going to show you and read the words to you the same way that I did just now. Different 15 words. Okay, I'm going to time 1 minute. Okay? Are you ready for the next round? Look carefully, and here we go. Mad, wrath, fear, happy, hate, fight, rage, hatred, temper, mean, fury, calm, ire, emotion, and rage. You have 1 minute. Write down as many as you can remember, either on your phone or a piece of paper or on your computer. As many as you can. Yep, on your palm if you want to. Yes, somebody just write like that. That's fine. But most of us have phones, so I don't have to distribute paper. Right? It's about 50 seconds left, 45 seconds left. Okay. 30. 15. 3, 2, 1. Thank you. Please stop writing. Now look at the answer. Give yourself a score for the second one. Let me know your score. Just shout it out. Is it 15? Is it 13? Nobody got 13? How about 10? Anybody got 10 correct? 10? Well done. Thank you very much for participating. Yeah, the second one. I asked you to score yourself the second one. Right? How many of you got 10? 10. 10. Excellent. Let me find the winner here. How many of you got 11? 11, correct. 11, no? Okay, so 10 is the maximum. Okay. Now, on the second list, how many of you has angry or anger on your list? All right. Yes, many of you did. Yes, angry on anger. And it's not there, right? You realize that? In fact, some of you probably has sweet on that first list and you realize that it's not there. What this shows? Study after study has shown that our own perception, confidence of how accurately we remember has nothing, absolutely nothing to do with the accuracy of our memory. Don't take my words for it. Check it out. This is a research study. Now, what has this got to do with dementia? The thing is this, if we can teach people who are at risk, people who have dementia patients, 50s, 60s, right, or even people with mild subjective cognitive impairment, right, many things about one concept, if they forget those other chocolate bits, they can still remember sweet, right, even though it's not there. That's what we want to do with dementia prevention. Right? We want to teach ourselves new things, many things about one thing or one concept, so that if we forget the fourth or fifth, we can still remember the one, even if it's not there, because it doesn't matter if really we remember chocolate or good. We want to remember sweet. Same thing. It doesn't matter if we remember mean, fury, ire. We want to remember anger. That's one way to train our brains. Now, wouldn't it be awesome if we have an app that can do this kind of training? And that can measure your degree of competence and then move you to a higher level, maybe more difficult, and train you up. This is. So today, if you remember Wayne as a geropsychologist, you may forget me when you have dementia or Alzheimer's disease. That's because, this is the neuroscience of it, that's because of cell death, right? The neurons cannot communicate. That's basically the science. Now, if you today remember me as a geropsychologist, but I'm also a caregiver because I've told you that story, and that I also practice mindfulness meditation, and you just listen to me give a talk here at NYP. Okay? If 3 of those connections fail because of Alzheimer's disease, you still have 1 more. You will not remember me forever. You may not remember my name, Wayne, but you may remember Chong. Or you may remember that this guy talked at NYP. And tell a story, and don't even remember his story, but this guy talked at NYP. Wouldn't that be better than forgetting me at all? Okay, you may not like me, fine, but wouldn't that be better than forgetting that something at all? Right? And of course, this is not the only way to prevent dementia. There are many other lifestyle methods. Today, we have in Singapore since 2013 the Healthier SG campaign. It has been rolled out, now more than 80% take-up rate and happy to know that actually many of these healthier activities like dieting, nutritious dieting, and exercise, and so on, good sleep, actually helps prevent dementia, the vascular aspects. So today, if we have digital technologies that can train us, it will be awesome. To help us become more motivated, to change our lifestyle, to be healthier, to train us in our cognitive abilities, our brain and our memory. But what if we have technologies that is just not for one person, but is synchronized? The caregiver has this app, the older person has that app, and if the older person falls, the sensor tells this app to tell that app to ring, to make a sound. Now, what if this is also picked up not just by the caregiver, but also the grassroots organizations? So I'd like to bring us back to this one. If we have digital technologies that could link up these organizations, then discharge from hospital is not just discharge and bring you to the next place. It's discharge and I know where you will go. And I know whether you attend service or not. And the service recipient would know from which ward you discharged. Eventually, and I'll leave you with this, eventually, in the year of COVID, I passed my PhD exam. There you see me. I went back to see my grandmother, this time her niche in the columbarium. And I'm reminded of this. One regret is I had no chance to show my little academic achievements to my grandmother, nor my mom, nor my dad. That's a regret I think I would live with for. But the other thing is this though. I realized that I could do something for caregivers. I could speak for caregivers. And that is why I'm here today. When I teach and train and speak up on dementia prevention, actually that's for caregivers. Because many caregivers have their older persons with dementia. And so then, if it's 1 in 10, right? Then the caregiver is at risk if that is a family member. Even if the caregiver is not a caregiver of a dementia patient, right? The stress, the burden, the physical inactivity or sedentary lifestyle that a caregiver might go through makes a caregiver at risk for dementia and a host of other health conditions, which has been found in research to be called caregiver burden. So today, I ask you to remember this, if you can. Could we take one more step towards building a well-connected community called the digital health community? It's not about inventing. Sure, companies will invent new devices, new solutions, try out new technologies. But we need a community around these technologies. If we can do that, we transform healthcare. If you'd like to stay in touch with me, I'm very happy to. That's my LinkedIn and my Facebook. And I'm happy to talk with you during the panel and during the tea break. You have my word.